right. Welcome, everyone. Thanks for joining the National Headache Foundation for today's webinar. Today we have Dr. Sarah Rahal, who is on the board of the National Headache Foundation. She's also an assistant professor of neurology and pediatrics at Icahn School of Medicine at Mount Sinai. She's a board-certified pediatric neurologist who also specializes in headache medicine. With that, I will let her begin her presentation on preparing your child with headaches to go back to school. Thanks, Sarah.
Thank you, Eric. Good afternoon, everyone. Today we're going to talk about being school-bound with headaches. So what we'll cover is what is migraine, what are common lifestyle triggers for migraine, and what unique challenges does the college environment present. We'll focus on some of the unique challenges of the college environment, but a lot of it is applicable to schools in other environments as well. What can you do to mitigate these triggers, and the importance of seeking medical care for migraine management. So what is migraine? Migraine is essentially just an inherited tendency towards headache. So it's an underlying predisposition that is genetic, so it tends to run in families, and it's a threshold phenomenon. So in the setting of enough triggers, a headache can be triggered. It's usually the final trigger that's the most obvious, but the underlying ones are just as important. So essentially, anybody can have a migraine if you give them enough triggers. Those who are predisposed to migraine, though, take less to set them off. So, for example, if you stay up late, you don't always get a headache. But if you stayed up late and then went to take a particularly stressful exam on an empty stomach and got dehydrated and drank lots of coffee, you'd probably get one. So all of the triggers contribute. When doctors see somebody with headaches, these are the criteria that they look at to make a diagnosis of migraine. So these are adult criteria. They require at least 5 attacks of headache, which last between 4 and 72 hours. The headache has at least 2 of the following features. It's either one-sided, it has a pulsating quality, it's moderate to severe in intensity, and it's worsened by routine physical activity like moving around, bending over, etc. And it's accompanied by either nausea or vomiting or light and sound sensitivity. Migraine in kids and teenagers has some distinguishing features from this. Number one, kids with headache usually have a shorter duration. So instead of the 4 to 72 hour criteria, headaches in kids can be as short as 30 minutes. Additionally, it's more common in kids for the headaches to be on both sides rather than just on one side. And very young kids may not be able to articulate that they have nausea, so they may instead just have anorexia, they avoid food. So why isn't it just tension headache? So while tension headaches are strikingly more common in the general population, as you can see here with a lifetime prevalence of about 80%, by definition, tension headaches are mild in severity. So people with tension headaches typically don't go to the doctor's office. They self-treat at home. So the headaches doctors see in the office are almost always migraine. You can see here over 80% are migraine. And then why isn't it just a sinus headache? So migraine is commonly misdiagnosed as sinus headache because migraine can also have features that involve facial pressure over the sinuses, runny nose, nasal congestion. So it's no wonder this is a common misdiagnosis. There was actually a study done in 2004 showing that 90% of the time, self or even physician diagnosed sinus headaches were actually migraine. This was another study that looked at pediatric migraine patients and some of these symptoms that mimic sinus symptoms, like fullness in the ears, nose running, congestion, teary eyes. And it demonstrated that 73% of pediatric migraine patients had some of these features with their headaches. So sinus headaches are usually migraine. So if you're listening to this webinar now, I hope I've convinced you by now that chances are your child or you have migraine. When I tell people what I'm doing, I'm often met with, kids have migraines? Yes, in fact, 20% of migraine patients have their first headache before the age of 5. So it's very common in the pediatric population. This chart demonstrates the lifetime prevalence of migraine. And if we zoom on the early part of the graph, actually, we see that from infancy to age 7, boys are affected slightly more often than girls. Typically, the age of onset in boys for migraine is about 7 years old versus 11 years old in girls. And then after puberty, a female predominance occurs, and this continues to increase until middle age. And then migraine declines in both sexes around age 50. So overall, the prevalence of migraine in kids is about 10.6%, and in adolescents, it's upwards of 28%. So going back to our initial premise here, this threshold phenomenon, what are these triggers that can set off the cascade of migraine when the threshold is reached? And so what can we do to intervene? Essentially, if we look at like what this science is, what's actually happening in the body with a migraine, in the setting of these triggers, a cascade of chemical activity is initiated in the brain. The phenomena is called cortical spreading depression, and that's believed to be what underlies migraine. So cortical spreading depression is this wave of electrical activity that propagates along the outer layers of the brain, and it's followed by another wave of suppressed activity in the nerve cells. And this is what happens with aura in those people who have migraine with aura. And aura is typically visual phenomena that precede the onset of headache. The wave of electrical activity also travels towards the base of the brain, and it activates a nerve called the trigeminal nerve. And the trigeminal nerve is the nerve that mediates all the sensation around the head and face. And this activation sets off pathways that cause changes in the blood vessels, waves of electrical activity, and then inflammation with release of all these chemicals around the brain stem that result in the pain and all of the other associated symptoms of migraine, like nausea and light sensitivity. So this is essentially what we think happens. And so we'll focus here. What are these triggers that set off the cascade? So what can we do? In studies looking at kids, the average number of triggers for an individual migraine patient is about 7. Notice that stress is the #1 trigger. Over 75% of patients have it as a trigger, followed by lack of sleep, warm climate, video games. Other major categories here involve an overall change in the rhythm of the day. So migraine patients should be creatures of habit. Fluctuations are the things that tend to set off migraine. The college environment in particular can be challenging in this regard. The patterns of the day may vary wildly. Teenagers are removed from the routines that they usually had at home. When we talk about the controllable triggers specifically, sleep is a huge one. 15 million American kids don't get enough sleep. Particularly note the number in teenagers who are supposed to be getting 9 to 10 hours at night, but 70% of them get only 7. Not enough. One of the most common headache patterns that I see in teenagers is called a Monday-Tuesday headache pattern, which results from a combination of sleep changes over the weekend, with adolescents in particular staying up very late and sleeping in late on the weekends, and then all of a sudden needing to go to bed earlier on Sunday to wake up for classes on Monday. It's the consistency that's important. So same time to bed, same time to wake, even on the weekends. No napping, avoiding caffeines and screens before bedtime, having 30 to 60 minutes of wind down time. This may mean altering the schedule, taking advantage of classes that start later on Monday, cutting back on after school activities if it means that you're staying up till odd hours of the morning to complete homework assignments. The roommate situation in particular in college may pose different challenges. For students with roommates, the sleep schedule may not be fully within their control. It may be useful to have kind of a roommate set of rules with agreed upon lights off time, no visitors past a certain hour. Rooming options vary wildly at colleges. So in severe cases of teenagers who have migraines triggered by sleep changes, it may be appropriate to request a single room, allowing for exclusive control over the sleep environment. Dehydration, I hear of this as a trigger frequently. There was kind of one formalized study that looked at this. This scientist randomized 102 headache patients to increasing water intake by 1.5 liters a day, or just counseling. And those who drank more water had a significant improvement in their migraine disability. The goal for water intake is about 1.5 to 2 liters a day or more. That's at least 3 to 4 regular sized plastic water bottles worth. Make it easy. Get a refillable aluminum water bottle to carry at all times around school, on campus. I usually recommend adding an electrolyte pack as well, but one without coloring or artificial flavors or sweeteners. I push this particularly in headache patients who have a lot of associated dizziness, along with increasing their salt intake. When it comes to diet, again, consistency is key. You'll notice the theme here. There was a 2012 study that looked at 800 adolescents and showed that those who had headache were the ones that tended to irregularly consume meals, particularly breakfast. And those who skipped meals more often had the greater headache frequency and disability. So about half of migraine patients report fasting as a trigger for their headaches. So small but frequent nutritious meals is probably best. The advantage of campus dining halls that are open 24/7 is that food is always accessible, but at the same time, the downside of that is that that doesn't encourage regularity in the eating schedule. So breakfast is often most troublesome for all students. So even if there's no time before class to sit down for a full-blown meal, students should have something to get them going in the morning, something to get that blood sugar stabilized after a whole night of fasting. I usually recommend something with carbohydrate and a substantial amount of protein. Protein helps regulate blood sugar for the rest of the day. So if you can get a protein load in the morning with breakfast, it gives you a little more wiggle room with the rest of your day. Keep the dorm rooms stocked. Depending on the study that you read, anywhere between 77% and 44% of people have a particular food item as a trigger for their headaches. The 3 most common food triggers are cheese, chocolate, and citrus fruit. That being said, these are not triggers for everyone. So eliminating all of these foods is not advisable. It only leads to nutritional deficiencies and makes finding acceptable food more challenging, which in itself can lead to headaches. Any food can be a trigger. These are just the most common ones that are reported. So in terms of food strategies, overall, regularity is key. Making sure to get something in the morning for breakfast, ideally something with a good dose of protein in it to help stabilize blood sugars moving forward in the day. And it should be a whole food-based diet. So plenty of green leafy vegetables, eliminate processed and packaged food, which is just full of artificial preservatives that trigger headaches, reducing sugary snacks, which only causes your sugar levels to peak and spike and then plummet, which triggers headaches. And particularly for teenagers leaving to college, just being aware that alcohol may pose a particular problem for people with migraine, as the sensitivity to alcohol is much higher than it would otherwise be. So you get getting hangovers and headaches and alcohol side effects happens at a much lower dose. I reserve a special slide for caffeine. Adolescents in particular drink large volumes of caffeine-containing drinks daily. So People may drink diet colas as substitutes for food. College students may drink a lot of coffee to stay up to study for exams. Caffeine's in a lot of products people don't even think about, like medications or iced tea. One study looked at teenagers with daily headaches who were using more than 200 milligrams of caffeine daily. For reference, a small cup of homebrewed coffee is about 100 milligrams, and a grande Starbucks is 550. In this study, they tapered caffeine intake over 2 weeks, and almost all of the patients in the study had a complete cessation of their headaches at 6 weeks follow-up. So caffeine is good and it's bad. It's in a lot of over-the-counter medications for headache. So in those who aren't chronic caffeine users, it can actually be helpful at relieving a headache. But if you are having 200 milligrams of caffeine a day or more, caffeine actually increases your headaches by a withdrawal mechanism. So those with migraine need to be very mindful that the max daily caffeine intake should be no more than 200 milligrams a day. Just reach for water instead. Aspartame, so what to know about this ubiquitous sugar substitute. There have been several studies looking at this, demonstrating an increase in headache frequency in migraine patients who are exposed to aspartame for even a few weeks. It's hidden in a lot of products, so it's important to read the labels. Gum chewing. This habit may also trigger headaches, actually. There was a study looking at 30 patients with chronic headaches and daily gum chewing, and with cessation of the gum chewing for 1 month, 26 out of 30 patients had improvement in their headaches, with more than half having complete resolution of their headaches. So pretty powerful data. So how do you figure out what your triggers are? The headache diary is key. So marking down any days with headache and the circumstances around it, weather, sleep change, stress, or otherwise. Can do it traditionally on paper, or it's really easy for teens to just track this in their phones. There are some great apps to help with this, like iHeadache or Migraine Buddy. The headache diary also serves another useful role. It can help your doctor decide what treatment may be most appropriate for you. If there's been an unexplained change in the pattern of headache, your doctor may want to run more tests. So even if you're doing everything right, there are times when you will get a headache. The most important thing is to have a plan in place, and if you have a good handle on what your triggers are, you can manage the things that are within your control to try to minimize the number of headaches you have. When it comes to migraine treatment, there's 2 kinds of medications that we use for headache. Abortive treatment is the medication that you take to terminate a new headache. So this is something you take early in the headache. You should treat aggressively, because the later into the headache you treat, the less effective any medication is. For those patients with more frequent headaches, your doctor may decide that preventive treatment is indicated. So this may include daily preventive medication, but there are lots of other options for prevention as well. In addition to avoiding triggers in the first place to prevent headaches, there are certain vitamin supplements that can be helpful at preventing headaches, also physical therapy, biofeedback, which is a mindfulness-based relaxation technique, addressing any comorbid stress issues or mood disorders, or acupuncture as well. The goal is that these preventive strategies make it harder for the brain to generate a headache in the first place. Essentially, they raise that headache threshold. When to initiate preventive treatment is not firmly established. It depends on a lot of factors, but in general, it's done when there are at least more than 6 headache days a month. It's important to meet with your doctor and discuss this early, because if it's a matter of preventive medications, those medications can take a couple of months to start taking effect, and it may require trial and error to find the correct regimen. So it's best to start this process earlier rather than later. Medication overuse headache is an important part of the plan, and something that is very under-recognized, but really important to be aware of. So one complication in kids who get frequent headaches is that when the headaches are frequent and you just continue to use abortive treatment for every headache, you may end up with more and more headaches as a result of it. It's actually a rebound phenomenon. It's similar to what happens with caffeine. This is called medication overuse headache. So initiating preventive treatment is essential in these cases of students with frequent headaches to prevent this vicious cycle or break it if it's already started. This can massively interfere with school functioning. Migraine sufferers are uniquely predisposed to developing medication overuse headache. So in general, abortive medication, either prescription medication or even over-the-counter medication, Tylenol, Advil, Excedrin, none of these should be used more than 10 days a month to avoid medication overuse headache. So in conclusion, for those teenagers with migraine, the strategy for transitioning to college or school is threefold. One, anticipate the lifestyle changes that the school environment will bring. For college in particular, it may mean a loss of structure, less control over your sleep-wake patterns, eating patterns, exercise. You have to do the best with the things you have control over. There's additional stress that comes with living independently, tackling academic challenges, going long periods without eating. So it's important to, number two, recognize your triggers. A headache diary can be particularly helpful at figuring this out and figuring out what's in your control. And number three, having a treatment plan in place. So speaking with your doctor about what's an appropriate abortive medication to take when you have a headache to aggressively and very early get rid of the headache and prevent it from progressing and interfering with daily functioning. Or number two, if the headaches are very frequent, having a plan in place for prevention to reduce the number of headaches that you have overall. Thank you.
Thank you for that. If anyone has any questions, feel free to type those in. We can I can pass those on to Dr. Rahal. We do have one right now. It says, my son has complained of dizziness for a long time. The pediatrician did not address it, but a psychiatrist has, however, not in depth. Is this common for early migraineurs? And then just for a little bit more detail, it says the boy is 11, and it's come on relatively recently.
Well, it's hard to say without knowing the other elements of the history, but when it comes to migraine in particular, there are versions of migraine that present with prominent dizziness as opposed to just prominent headache. And so that it's a diagnosis of exclusion, meaning it's very important to rule out other things that can cause dizziness, like problems with the inner ear or even GI issues or sinus issues. But if those things have been ruled out, there is a consideration that some patients who have episodes of dizziness may have a version of migraine, and in those situations they respond to traditional migraine treatments, even though it's not necessarily a headache. Great.
And then you talked a little bit about kind of the steps that someone going off to college can kind of take to kind of control their lifestyle. Do you have any recommendations for maybe someone a little bit younger going into school and making sure that teachers or nurses or kind of the staff is aware of the situation?
Yeah, that's a great question. You know, in my experience, most schools are very open to finding a proper action plan for a student who has a medical condition, and migraine certainly is no exception to that. So having a plan in place which involves a conversation usually between the parents, the school, and the physician caring for the child may, you know, allow for an academic environment that's more conducive to learning and minimizes the triggers. For example, kids who have a lot of sensitivity to screens may be allowed to use different modalities to learn rather than sitting in front of a computer all day, or allowed to complete homework assignments on paper rather than on the computer. There may be allowances to rest in the nurse's office if there's a headache, and to be in a dark and quiet place to avoid further exacerbating the triggers. I've had students who are in young elementary school who have multiple levels to their school where they have to go upstairs for certain classes, and that sometimes can be a trigger for a child with headaches, to be in the crowd and kind of fighting their way to get up the stairs. And so it means that maybe there's an accommodation for the student to leave to switch between classes earlier than the other students. You know, sometimes there are creative ways to go about it, but an open conversation with the school and the physician to come up with strategies that are beneficial for the child is usually, you know, better to put in place earlier rather than later in the school year.
Kind of along those lines, could you address, question is, could you address school avoidance for children with migraines? Anything that parents should be aware of?
Yeah, you know, this is something that's that comes up a lot, and I think there's a subtlety here that's important to differentiate. So a lot of children, unfortunately, are put into the bucket that they are making up their headaches to get out of school. And I think that is the exception and a very rare occurrence. The school environment can be very stressful. And stress is, as we've seen from one of the earlier studies that I showed you, stress is the #1 trigger for people with migraine in over 80% of cases. Stress does a lot of things under the cover. You know, it changes the hormones in our brain, changes the way that the nerve pathways communicate with one another. And so stress actually triggers migraine, and the fear of getting a migraine while in the stressful school environment may make children a little bit nervous about going to school, which also triggers the migraine. So it's kind of this vicious circle. So the question that you asked before about having accommodations in place for children entering school, I think is so important just to prevent this cycle of school avoidance, because the stress of school is actually triggering headaches as well.
Well, it looks like we don't have any more questions, so I want to thank everyone for joining us. If anyone wants to rewatch this or maybe pass it on to friends or family, it should be up in the next day or two on our website, www.headaches.org. So feel free to pass that on if you think anyone else might find it helpful for their child. And I want to thank you for your time, Dr. Rahal.
Thank you. Thank you all.
Thanks, everyone. Have a good night.